And I wish this particular webinar on this mental health issue will be surely benefiting all of us. I once again extend my warm welcome on my own behalf and on behalf of the Immanuel College, specifically on behalf of the IQAC Immanuel College. Thank you. God bless. Have a good day ahead. Thank you.
Thank you so much, sir, for your warm welcome to all the participants, as well as for the introduction of Ms. A. Charani in this webinar. I would also like to apologize for not having this webinar on the scheduled date, that is last Saturday, due to unavoidable circumstances. But I hope and believe that today we all will be more placed. Okay, we all will be more placed. So please be very attentive. All right, please be very attentive. And if you have any doubts at the end of the webinar, at the end of the program, you may kindly ask questions in the comment section, and our speaker, Ms. A. Charani, will try to answer to that. Okay, I now give the rest of the time to Ms. A. Charani for your presentation.
Okay, good morning, everyone. Am I audible?
Yes, you are audible.
Yes, ma'am.
Okay,
Yes, ma'am.
good morning again. Thank you, Principal Sir. Thank you, Ma'am Nati, and thank you to all the participants who are joining with me in this webinar. So before we start with the presentation of the webinar, I would like to give a little bit, share some of the housekeeping rules with all of you. As I said, since I'm going to be presenting, I hope that everyone, you're a little bit aware of how to use this Google Meet, and therefore I would ask you all not to present while I'm presenting, okay? Because while I'm presenting, if you start presenting, then it's going to clash with the PPT, and we will have a bit of trouble, technical trouble, all right? And I would like you to keep your mic, your audio mic to turn off, mute it, okay, for now. And I'm very sure that, see, before we start with this presentation, I would like to acknowledge all the participants here. I think most of them are students, right? So as the students, maybe many of you will be also faculty, but I'm very sure that the faculty members, they are a little bit aware of what mental health is, or much aware also. But for the students, they might not be that aware yet. So at the end of this presentation, I know that most of you will have lots of questions based on this topic, and therefore I want you to let you all know that I will address as much as I can in the time that we have been given today. All right, so without any further ado, let's start with the presentation. Okay. All right. Okay, can everyone see this?
Yes, ma'am.
Can everyone see the slide?
Yes.
All right, thank you. So today's webinar's topic is Say It Brave, right? Say It Brave, initiate the conversation. All right, so many of you will have this question at the topic, Say It Brave. Why initiate the conversation, right? So as we go forward with our presentation, you will get a glimpse of what we're trying to say with our own topic. Okay, so now the outline of our presentation today will be, we will first talk about India and mental health, myths on mental health, understanding mental health stigma, terms, types, and impacts. How should we talk about mental health? Immediate steps to solve the mental health issues in our country. Can everyone see? Okay, so before I start with this presentation, I want you to let me share something with you. See, I was brought up to the belief that thinking about mental health, thinking about mental illness, or even talking about mental illness was a curse. That the only way to ignore it was, the only best way to deal with any such mental illness was to ignore it and get on with life, right? But how do we get on with life? We're all humans, right? And when life happens, mental health happens. Mental health happens, mental illness happens, right? So mental illness in, let's take the context of our country, India. Mental illness is one of the most underappreciated crises in India. I hope everyone can agree with me on that, right? Mental illness is the most underappreciated crisis in India. So now, I don't like to admit the fact, okay, but I will reiterate the fact that India is the most depressed country in the world, as per WHO. So today's topic, we will deal on why and how can we address this crisis together. So, as we said, now, as we start on with this presentation, I would like to ask all the participants in this webinar this question. Now, the question is, what is the first thing that comes into your mind when you talk about, or what is your immediate reaction when you talk or think of mental illness or mental health? Matt, right? Mental illness. When you talk about mental health or mental illness, the first word that will come to your mind is Matt. I would like to ask the participants again to please mute your audio. Okay, so Matt, some of those words. Psycho. When you talk about mental illness, you start associating crazy, unpredictable, scared, creative, unhinged, dangerous. See, all of these words, all of these words are some very commonly used associative words which we use today in our daily conversation. So we have settled for accepted discriminatory lexicons. Now, accepted as in, see, whenever we use such things as crazy or psycho, we never give it a thought, right? We just accept those terms, right? So we have settled for accepted discriminatory lexicons whenever we use mental illness. So it is a reminder that the words we choose and the meaning behind those words, the meaning that we attach to all these kind of words like mad, psycho, crazy, creative, they influence our feelings, attitudes, and beliefs. Okay? So these words, these kind of words, mad, psycho, crazy, they are not used to portray anything in a positive light, right? And these words can be very extremely damaging to the millions of people who are living with mental illness, their immediate family members, and even their caretakers. These kind of words, all right? So be very mindful that generalizing, these are all generalizing of such words can be they are also a form of stereotyping. So when we use these kind of words, for example, like mad, as I said, unhinged, dangerous, for example, it erodes our progress, to improve our mental health care system and treatment, even in our own society, in our governmental society, governmental structure. Now let's go to the next slide. Now, before as we start dealing with the main topic of our webinar, I would like to ask these questions. In order to guide our discussions better, I would like to ask these questions. Number one, to all the participants. These questions are open to all the participants. So, number one, what are some of the things that you have heard about people with mental illness? Now, why do you think people with mental illness are stigmatized? Do you think our country is contributing enough to the mental health sector? Now, how do you think stigma affects the lives of the people with mental illness? Do you think it's possible to change community attitudes towards mental illness? Do you think your attitude towards mental health and illness reflects with the general community attitudes? If these are all yes, let's say, how do you think you can help? These are the questions, some of these questions which you can, question your own self and question you raise this question among your own immediate friend circles and then start the discussion. Okay, so everyone is, can everyone see the slides about mental health?
Yes.
Yes.
Yes,
Okay,
yes,
that means,
yes, right.
and I would like to say again, if I am too fast or if you want to go back to the previous slide, please do let me know. Okay, now let us go to mental health. So according to WHO, mental health is there is no health without mental health. right? There's no health without mental health. So see, the consideration in our society, the consideration to talk and address about the elephant in the room. What is the elephant in the room here? Mental health. Okay, mental health, it comes from a very small portion of our society. So there's only a few members in our society who are ready to talk about mental health. And that few members includes you, the participants of today's webinar. You are now ready to talk about mental health, to discuss about mental health, to know more about mental health. You have come to participate in this webinar. So besides our country, in the world itself, the consideration to talk and address about this mental health is very few. Okay, so mental health can affect anyone. Please be very sure that before we start with the topic, mental health can affect anyone, all right? No one is safe from self-doubt, depression, loneliness, mental anxieties or disorders, right? Especially when we're, as sir mentioned, especially when we're undergoing social, economic, financial crisis and emotional crisis right now at the moment due to pandemic situation, when nobody is safe from mental health. Clear? So now let's go to mental health. What is mental health? Mental health includes our emotional, psychological, and social well-being. Clear? It's just like our physical health. Physical health indicates all the well-being of our physical structure, right? Health. So the same thing, well-being of our social, physical, and psychological and emotional well-being, mental health. So good mental health isn't about feeling happy all the time or being confident 100% all the time. Clear? So it is about living productively and coping well with your problems. Okay? So, for example, before we start with the example, I would like to reiterate the fact that the word mental health and mental illness, they have been commonly misused by people. So mental health, when you talk about, say, as going back to the previous slide, I already mentioned that people without knowing properly the terms, they commonly associate this kind of derogatory, discriminatory words like crazy, dangerous, psycho, right? When it comes to mental health. Now, I will try to differentiate what mental health and mental illnesses are, okay? So mental health is our social well-being, emotional, psychological, and social well-being. And mental illness is an illness that affects the way people think, feel, behave, or interact with others. So mental health is our well-being, while mental illness is an illness that affects the way how we think, how we feel, how we behave or interact with others. So now, half of all mental illness starts by the age of 14. But most cases go untreated and undetected. Now we will deal on why these cases go untreated and undetected in the next slide. And also, please keep in mind that there are many different mental illnesses and different symptoms that impact people's lives in different ways. All right. So let's take an example. For example, let's say I am depressed. I am undergoing depression, but how depression affects me and the symptoms of depressions will be very different as per another person who is also facing the same depression. Clear? So it is entirely possible to have good mental health even with a mental illness diagnosis. So this, the last point, it is entirely possible to have good mental health even with a mental health illness diagnosis. This one I will explain more in the next slide. But please keep in mind, today is our main message of our topic today, webinar topic message. The main message here is we don't choose to have any mental illness. Please remember again, we do not choose to have any mental illness. Just like we do not choose to have any kind of physical illness like cancer, cardiac problems, or let's say kidney problems or any kind of physical problems, we also do not choose to have any mental illness. So now let's go to the next slide. India and mental health. Before we start with mental health, let us first go back to the scenario in our country itself, okay? So India accounts for nearly 15% of the global mental, neurological, and substance abuse disorder. So where about 7.5% of the Indian population suffers from mental disorders. So because of this huge number, huge percentage in the world scenario, WHO has already labeled India as the world's most depressed country, closely followed by China and US. So as per the label, the National Mental Health Survey of India in 2016 says that through their study, they have found out that 1 out of 10 in our country suffered from mental illness ranging from depression, anxiety to schizophrenia with no discernible rural-urban differences. Okay, so let's go back to our society. In our society, if you go about and ask people, do you think mental illnesses are more in urban cities or rural places? The answers which we always find in our community will be, of course, more in urban cities. Okay, every time, right? But through this study, they have found out that there is no discernible differences between rural and urban. All of us, whether it is urban or whether it is rural, 1 out of 10 people in the country, they suffered from mental illness. So ranging from depression, anxiety. Depression is a mood disorder. Anxiety to schizophrenia, all these are what do you call, all these are mental health disorders, which we will if you want to know more about it, I can answer all this in the last slide. Okay, now nearly 90% of these people, out of 15%, nearly 90 of them, they receive no care at all in the past year. Okay, so it is no exaggeration to suggest that our country is undergoing a mental health epidemic along with COVID pandemic. Now, in this population which have 1.3 billion population in our country, we have only 5,000 psychiatrists. So therefore India endures an 87% shortage of mental health professionals. So when you calculate that, we have only around three psychiatrists per million people in India. When we have only that less professionals to deal with mental health, what happens? World's most depressed country title happened, right? Okay. Now, 95 of those with mental health problems remained deprived of treatment due to stigma, shame, and getting shunned from societies. So the main reason behind why we're facing all these mental health problems is because of stigma. So the main topic of our webinar is stigma, right? So now let's go to that. So the treatment, because of stigma, the treatment gap is over 70%. That much out of 100, just imagine 70% of people are not receiving treatment due to stigma. Now, the amount spent on mental health, again, when it comes to India, the amount spent on mental health comes to 33 paisa per mental health patient. So for example, that means we are lesser than Bangladesh itself. I mean, Bangladesh, they're spending around 0.06 percentage. So we're only spending around 0.03 percentage, the amount, okay, that the amount that the central government of India gives for mental health care. Now, according to a survey again conducted by the Indian Psychiatry Society, within a week of the start of our lockdown, that was, let's say, 25 March, the number of reported cases of mental illness in India had risen by 20%. Just imagine, within a week itself, our mental health crisis in India had risen to 20%. So 12 of Indians, and please remember, let's go back to the first slide. Please remember that mental illness start as early as 14 years. Right. So 12% of Indian students between the age of 4 and 16, they suffer from psychiatric disorders. Psychiatric disorders like bipolar, psychiatric disorders like schizophrenia. Okay. So WHO have also mentioned that India has the highest rate of suicide in the world between the age group of 15 to, here it should be 29. Okay, between the age group of 15 to 29 years, India has the highest suicide rate. So let's just take it. A student commits suicide every hour in India, with the, let's say, about 28 suicides reported daily. Clear? So among all this kind of suicide, Sikkim has the highest suicide rate among the Indian states at 37.5%. Among all if you have to count all the steps of India with regard to suicide rate, Sikkim, the state Sikkim has the highest suicide rate among the Indian states at 37. So till here, is everyone clear? Can I go to the next slide?
Yes, ma'am.
Okay. So now, after learning about the scenario in India, what should we do? First, why this much of, as I say, why this much of gap, 95% gap is there in India itself when it comes to mental health? Why? Because of the myths that follow mental health. As I've already mentioned, how in my own experiences, or maybe many people will relate with me or even agree with me when I say that talking about mental health was a curse, right? Was considered a curse, right? That when I talk about it, that curse is gonna follow me, right? So let's see how our society, why the myths behind the mental health stigma. Clear? Okay, now number first. Now anyone, do you relate with these myths? Anyone? See, for example, number one, mental illnesses are rare, incurable, and lifelong. This is what many people believe. They believe that mental illnesses are very rare, and they are also incurable. If you are diagnosed with mental illnesses, then it will be incurable and it will be lifelong. So what happened? I want to debunk this myth by saying that it is not rare at all. Okay, 1 in 4 people all over the world, they suffer from mental illnesses. Therefore, it is not rare. And 1 in 4, maybe by this time it will lead into, if we don't do anything about it, it will lead into 4 into 4 instead of 1 in 4. Now, what about incurable? So again, it is with appropriate treatment, with appropriate treatment, medication, and psychotherapy and support, they are able to live with it in the community, and therefore they are curable, they are treatable. Clear? And it is not lifelong. Okay. Number 2, myths. People with mental illnesses are usually violent and unpredictable. We have already described about this in our associative words, right? So many people believe that people with mental illnesses, they are very violent and unpredictable. So what do we do? That these kind of thoughts influence our behavior, and therefore we try to avoid them. We try not to associate with them, right? So what do we do? Is it true? Okay, let's go. Let's go forward. Now, mental illnesses are a form of intellectual disability or brain damage. We always think that when we heard of anyone telling that they are living with mental illnesses, it can be as mild as, let's say, depression or anxiety or panic attack, right? So we think that just because you have stage fright leading to panic attack, that means there's something wrong with your brain. Many people believe that. So we would here today in our webinar, we would like to all come together and debunk these myths. Okay. Now, people with mental illnesses should be isolated from the community. Again. So, as I've said in the first point itself, people with mental illnesses, they don't have to be isolated from the social community. Why? With proper treatment and medication, they can live a much better life than the ordinary humans sometimes. Very productive life. So if you try harder, again, one thing which we always find in our friend circle itself, immediate friend circle also, you will find this kind of words. If you try harder, you can make your symptoms go away. Your symptoms includes not being able to sleep on time or cannot sleep at all, which we call it as sleep disorder, like insomnia, or your sudden weight gain, sudden weight loss, or inability to eat food or anything. So with these kind of symptoms, we believe that no, if you try harder, all these kinds can go away. If you think that you're going to sleep, you can sleep. If you think that you will be happy, then you will stay happy instead of being depressed, right? So this kind of myths, as I've already mentioned, we do not choose to have any kind of mental illnesses. Therefore, even if you try to will it with all your might, that I will will it away, I will will away all my disorders, let's say, all the symptoms that you're having, experiencing at the moment, it cannot be done so. Okay, positive thinking is positive thinking is a way forward, but it's not the only way. Clear? So while thinking of positive thing, you also have to undergo proper counseling and proper medications, and therefore it can lead you into your recovery route. Clear? Keeping a job is too stressful for individuals with mental illness. Imagine again. Here, we always believe, therefore, thinking such myths where people with mental illness, for example, like depression or anxiety, people with anxiety, let's say, they keeping a job is too stressful, therefore please don't keep, therefore they will shun it. So all these kind of myths are unreal. Okay, they are not true. And then again, this one, more likely to commit a crime. What do you think? The only word which we always associate with this myth is dangerous and unpredictable, right? So is anyone willing to debunk this fact? More likely to commit a crime. Do you believe in that? Do you think that people with mental illnesses, they are more likely to commit a crime? Anyone? Everyone agrees with this.
Yes.
Everyone agrees with this. They are more likely to commit a crime.
Possible.
Okay. Yes. Okay. Possible. But I would like to say, okay, that people living with mental illnesses, it is more likely that they are a victim instead of the one inflicting. So actually, research has shown that they are nearly 4 times more likely to be a crime of victim of a crime instead of the one perpetrating. Clear? 4 times more likely and 4 times in actuality that they are victims instead of the perpetrators. Now, a mental illness is caused by a personal weakness. This is what we believe. Just because if you, let's say, for example, if your friend says that they cannot sleep on time, let's say, what do? We start pointing fingers at them saying that maybe it is because you're playing games too much, because you're not thinking properly, you're being very pessimistic lately, right? We always blame them. As again, please always refer back to the message of our webinar, that is, we do not choose to have mental illness. Nobody chooses to have any mental illness, just like nobody chooses to have physical illness. Okay, and also again, children and teens don't have mental health problems. For example, teenagers and children, especially when they come and complain to you by saying that they're having panic attacks, that they cannot breathe, let's say, or that they cannot sleep, then we think that, oh my god, you guys are very young, you guys should not be experiencing this kind, you should not you don't even have stress, right? So you can deal with this easily. These are not mental health problems. This is one myth which we commonly use in our society. So as I've already mentioned in a previous slide, as the age from 4 to 16, and let's say the age of 14 especially, many mental illnesses cropped out at that age itself, and if we do not deal with it properly at that time, it can lead into a major disorder. Again, therapy is a waste of time. This is what, especially as a counselor, which we always find. Okay, when we initially in our conversation with the clients, what they will always say when we ask them, why haven't you come sooner, then they always say, therapy is a waste of time. I believe that, even my own society believe that, my family members believe that therapy is just a waste of time, it's just talking, or it's just whatever it is, right? So we would like to debunk this fact. We, as all the participants of webinars today, please know that with proper therapy, 70 to 90% of the 70 to 90% we have there's proper success in recovery, okay, from all these mental illnesses with proper therapy. Okay, now let's go to the next slide. Now I want all of you to check on this kind of very similar sentences which you might be using with others or others might have used with you. So do you recognize any of these? Some words like snap out of it, pull yourself together. How can you have a family when you can't even look after yourself? Put it behind you, it happened years ago. It can't be true. Maybe you're not getting better because you're not trying hard enough. You are too stupid to get a college degree. Is that all you're depressed about? You won't be able to concentrate enough. See, this kind of words, for example, if a person say that I am unable to sleep, let's say, then what is your immediate reaction and what is your immediate action? That words, you say, pull yourself together, snap out of it, right? Or, for example, put it behind you, it happened years ago, which we really like to use it very often, right? So, for example, if a person comes and says that, if your friend, let's take it, your friend comes and say that, back then, because of that situation, I'm unable to cope with it for now. Then what is your immediate action? You say, it happened years ago, forget it. Right, we always used to say that, but that is not how our mind works. Clear? That is why there's such a word called as trauma, PTSD, phobia. Right. So when any incident, unfortunate incident happened to you years back, let's say, and if you have not addressed that incident and the reactionary behavior of that incident, then it will lead into PTSD, post-traumatic stress disorder. All right. And then also, for example, PTSD, one very common incident or example which I can share with all of you is like soldiers who have undergone, war and then all those hardships. When they come back from war, they are not properly counseled. They are not being given proper treatment, intervention treatment. So what happened? They will go back home, leading to PTSD whole night. Therefore, when you read proper articles of, for example, let's say, then because of PTSD, post-traumatic stress disorder, that has happened, that they have experienced years back during the war, it will always haunt them through nightmares, through their behaviors, and therefore it can lead into suicide also, killing their whole family, killing the community also, sometimes killing themselves also, or unable to work productively after their job. Okay, so again, you are too stupid to get a college degree. Another very big words or sentence which we often use in our society by our own immediate family members also, or even by our own teachers also, or even your friends themselves, right? So for example, just because you are unable to get good grades in your college, academic college, let's say, does not mean that you are having a mental illness or you're too stupid. Okay, so these connotations like stupid, idiot, morons and all, they have a proper meaning to it, right? Proper, with proper IQ. Therefore, please make sure that you don't use such words, okay, as responsible people. Now, again, a simple thing like people scolding you, a person scolding you, or a simple thing like you not getting the grades that you're expecting to get can be a stress, a trigger for your stress. Okay, those simple things can trigger something that is already being developing. Clear in your mind? Mental illness. All right, therefore when you say that, oh my god, I cannot sleep today, or I cannot study these days because of the exam that is going to happen, I am not sure when that exam is going to be fixed, but I'm very worried and I'm very anxious that sooner or later suddenly they might announce it, and then I feel that I will not be prepared. Let's say one of your friends shared that with you, let's say, and then what do? You start, is that all you're depressed about? My god, you should be depressed about this and that, not that kind, right? We love to use those kind of words, right? So please be sure that a simple thing like exam stress, or a simple thing like where your friends hurt you with some simple word, let's say, can be a big stress trigger, can be a very big trigger to something beyond your health later. Clear? Okay, now let's go to the next slide. Now, okay, since we have already talked about the scenario which is happening in India and why it is happening, what are the myths which we always use, why we use all those associative words, the myths behind all those. Now let's go to understanding now. After learning why, after learning how we use them, let's go to understanding, okay? So understanding mental health stigma. So stigma is a broad term. By now, I will not really be focusing on that very definition of stigma itself, okay? So I'll just go directly with what stigma is all about, all right? Stigma is a broad term used to describe the negative, stereotypical thoughts, attitudes, and feelings about people on the basis of the traits of a person. Traits here as in personality traits, character traits, or even your own ethnic traits. Traits of a person or groups as less worthy of respect and recognition. So whenever you're using stigma, what happened? Whenever you use any stigmatizing words or behavior, you are considering a person based on their character or personality trait that they are less worthy of you, less worthy of your support, less worthy of your respect and recognition. So the level of stigma which we are experiencing in our society today, it has not changed over the last decade. What is being stigmatized? What are the words and the actions and those people which have been stigmatized in the last decade? It is also being stigmatized. It is being continued to this day. Okay, so our job is to make sure that this kind of continuous stigmatizing word, behaviors, and feelings are changed. So, stigma is supported by ignorance, prejudice, and discrimination. It is supported by all those three. Ignorance. When you're ignorant of anything, it leads to stigmatization. When when you have prejudiced notion of somebody or anything community, it leads to stigmatization. Discrimination will also lead to stigmatization. Okay, and it is perpetuated by inaccurate misrepresentation of mental illness. How is it misrepresented? Through our myths, which we always use, through those associative words which we use, through those what do we say, those sentences that we use without properly thinking how it is going to affect somebody, right? So 3 out of 4 people who suffered from mental illness report feeling stigmatized. Just imagine, 3 out of 4 people. That means we have around how many? Around 200 participants today, right? In these 200 participants, 4 out of 4, there's one people who are having mental illnesses. So around, let's say from 200, how many of us have mental illnesses here now? Just imagine. So again, from all of them, 3 out of 4 people who suffered from any kind of mental illnesses, let's say anxiety, mood or disorders, depression, insomnia, for example, they all feel stigmatized by certain words, behaviors. Okay, so okay, stigmatizing somebody can be unintentional also. It can also be, subtle. Okay, the way you say it does not have to be very a big thing. Okay, the way you behave, but it can be very subtle also, or it can be very unintentional. For example, let's take the example of Halloween in US, right? People, they love to as uh, dress up as monsters who have mental illnesses, like they love to dress up thinking that when they wear such characters, for example, then it gives them certain words, right, like crazy, dangerous, and all. So that kind of dressing up as some people with mental health situation, that can also lead to stigma. And then, for example, let's say in media, right? Media, everybody will know. They sensationalized any kind of topics based on mental illnesses, right? The villain in most movies will be always suffering from certain kind of disorders, mental health disorders, right? So when you keep watching, when you're being what happened when you're always being how do you exposed to such kind of notions, thoughts, or behaviors, or even ideas from those kind of media or entertainment, for that purpose, you are being conditioned. conditioned. You yourself sometimes you will not know that what you're thinking about, what the words which you're using, like crazy, stupid, these are stigmatizing. So you are conditioned. Okay, therefore stigma which sometimes you're using can be unintentional or subtle. Okay, so because of stigma, people, they will put off seeing a doctor. Okay, seeing a doctor, a therapist, a counselor for years or even months. Okay, or say never, also they never visit also, because they're scared that they will be shunned, right? So this in turn, when they put off such, what do you say, when they put off such um, appointment, let's say, or their rate of recovery is very less. Okay, okay, now let's go to the next slide. Now let's talk about stigma better. WHO in 2001 has identified stigma as the single most important barrier to overcome in the community towards mental illness. See, for example, instead of helping with monetary support, let's say, instead of, you know, bringing more awareness, let's say, if you can just remove your simple stigmas which you have, right, through your words or actions, like whenever you're using those words, as I've mentioned, or whenever you're using all those myths, for example, then that alone can help in the road of recovery. Okay, so if you are able to overcome today after learning this, if you are able to overcome and change the way you use your languages, change the way you behave, or change the way you think about mental illness or people living with mental illnesses, then it is a very big barrier that you yourself have overcome. That will lead to ultimate change in seeing how the perception of mental illness in our society. Okay, so now number one, stigma. Stigma is a deterrent to seeking proper treatment. It is number one, the biggest risk factor of, you know, having not been able to properly recover, okay, by people living with mental illnesses, is from stigma. Okay, because of all this stigma that they'll be termed as crazy, psycho, dangerous, they're scared, and therefore what do? As I said, they put off seeing doctors whenever they're, you know, whenever they're experiencing any kind of symptoms. Also, they are very scared that they will be termed, they will be labeled as someone with mental illness, right? So they do not follow through, or they do not seek for any treatment. Okay, and then stigma, it is everywhere. It is in the media, in the words we use, and in our attitudes. Already mentioned, it is everywhere, right? In the way, even in our own society, even in our own friend circle or family member, it is everywhere. It's in the media, as I've already mentioned, in the words we use, like those little accepted discriminatory lexicons that we use, and in our attitudes, through discrimination, through stereotypes, through prejudices. It has roots in fear and misunderstanding. When you fear some certain thing, when you fear a concept, and when you don't properly understand what mental health stigma is, what mental illness exactly is, then it will lead to more and more stereotypes. When you understand what mental health is all about, when you understand what depression is, and how can it be treated, for example, then you will not be having any kind of stigmatizing words like dangerous just because a person is having depression. Clear? So stigmatized opinions held by people rely on myths and misconceptions. They rely on those myths that I've shared in the previous slides, right? So when you're, let's say, when you have started, for example, it can be unintentional, as I've already mentioned, when you start using those words or sentences, or when you start when your friends are using those words on you, or you're experiencing in an environment where there's such stigmatized notions based on mental health, then please check yourself, educate yourself better. Now, it often leads to discrimination in the form of, number one, denying direct resources like housing or jobs. Okay, for example, like direct resources can be in the form of not being able to have a proper family, not being able to hold a proper job. Clear? For example, a person who has past drinking problem, with proper therapy, with proper rehabilitation, they have overcome their, let's say, drinking abuse, let's say. But just because they have a history of case drinking problem, they are now denied any job. Okay, so it often leads to discrimination when you use stigma, no? So people with mental illnesses, they will be discriminated in two ways. Number one, denying direct resources. Number two, structural discrimination, experience in the form of economic, social, legal, and institutional levels. All of them. Institutional levels to legal levels to social economic, they are going to face everything. So stigma is a, as I've mentioned, it is a very big deterrent. Now, terms related to stigma. Number one, there are three terms which is related to stigma. As I've already mentioned, that number one is stereotypes. Number two is prejudice. Number three is discrimination. How do we use stereotypes? So, for example, the stereotypes is about the attitudes about a group of people. For example, all people with mental illnesses are dangerous. So that is your stereotypes. That is the attitude which we have over a certain group, let's say. So what do we believe? We think that all people with mental illnesses are dangerous. Now, what happened? These kind of stereotypes will lead to prejudice. Prejudice is now agreeing with the stereotypes without knowing or understanding, right? Without questioning your own attitudes that all people, how can all people with mental illnesses are dangerous, right? So if you don't question that, it will lead to prejudice, that is agreeing with that stereotypes. For example, now you'll start thinking, I think people with mental illness are dangerous. Now you will start thinking like that, and as such you will follow through with that behavior, with that attitude. It will influence your behavior. Now, what is your behavior? It will lead to discrimination. How? Behavior that might result from this stigma, stereotypes, and prejudice. For example, now, since the stereotypes which you have experienced in your community is all people with mental illnesses are dangerous, therefore, don't talk about mental illness. Don't even think about mental illnesses because it is dangerous. And therefore, if you talk about it, then you will also contradict, let's say, like a virus, right? And then you will also become dangerous, let's say. And then what happens? And then after that, when your society teaches you in such kind of stereotypical concepts, then you develop your own prejudice. I think people with mental illness are dangerous. Now, how do you behave with such kind of thoughts? You start, I don't want people with mental illnesses around me, therefore I don't hire or befriend them. So this is how it leads to discrimination. With that kind of concept, now you start behaving. You will not try to associate with anyone who claims that they have any diagnosable disorders like depression, right? You will not try to associate yourself with them or even be friends with them or even be seen talking with them, even in the college campus itself, or even in your own immediate circles also, right? You will try to avoid them like anything. So these are how it works, from stereotypes to prejudice to discrimination. Your own thoughts, your own feelings, and your own behavior, it influences. Now, let's go to stigma, the types of stigma. So number one is there's a thing called social stigma. What is social stigma? Social stigma means it involves the prejudice attitudes, which I've already mentioned, attitudes, behaviors, discriminations, which other people have over a person who is living with mental illness. All right. So as I've already mentioned, for example, it can be a person not getting hired for having a past drinking problem, right? Number two, self-perceived stigma. So self-perceived stigma is this one. It involves an internalized stigma by that person who is living with mental illness. That person, when they are not educating themselves about mental illnesses, then when they are diagnosed with, let's say, depression by your own school counselor or education counselor, for example, then they start thinking, I am very stupid. I am not worth it. I am a dangerous person. I am not a proper human being because I have this stigma. I have this mental illness, right? So it will lead into, for example, let's say low self-esteem. Okay. Now, label avoidance stigma, right? Label avoidance stigma, it is one of the most harmful forms of stigma. Okay, label, we already know label. What is label, right? So for example, when we talk about label avoidance stigma, it is when a person does not choose to seek mental health, right? Mental health treatments, because so that they can avoid being assigned a certain label, like um when a person thinks that I will be, if I ever go to a counselor and if the counselor thinks that I'm having depression, then I will be called a depressed person. Therefore, I don't want to be called as that. Therefore, I don't want other people also to see me as a depressed person. Therefore, I will try to avoid it. I will not go for treatment. I will not even ask for any help. I will deal it by myself, right? Label avoidance stigma. Okay. Now again, stigma by association, courtesy stigma, which we always find. This number 4, which this one stigma we always find in our community. How does we find? So it happens, this kind of stigma by association occurs when the effects of stigma are extended to the immediate family members, not only to the person living with mental illness, but to the immediate family members, relatives, or what do we say, caretakers, the one who are taking care of the person with mental illness. So in our society we'll say in their family they have one person with mental illness. Sometimes he's a little bit crazy. What do we use? Well, how do we say crazy? How do we associate that word? Just because that person is very creative, does not behave like the society wants to behave, does not sleep or work too much or sleep too much or doesn't talk at all and only does their word, we term them as crazy. We term them as someone different, right? And when someone is different, then we immediately label them as person with mental illness, right? So for example, in a society, in a family like that, what happened? We stigmatize all the family members themselves. My God, if you associate with them, all the members, they'll have a little bit of mental illness. All of them will start saying that. Even the person who are friends with them, don't befriend them. You will also start having all those, right? Their generations also will follow with this mental illness. All those are myths. Okay, so we stigmatize people through association also. Again, and last, number 5, there is health practitioner stigma. So this kind of stigma happens when anytime when a mental health professional, for example, even doctors or nurses for that matter, not even mental health professionals themselves, or any kind of mental health professional, when they allow this kind of stereotypes, okay, and prejudice about mental illnesses to negatively affect a patient's care, right? In sometimes in hospital, or sometimes doctors or even nurse or caretakers themselves, right, without choosing their word properly, they diagnose something, or without choosing how they should construct their sentence, they sometimes without proper filtration, what do? They just say it out, right? And then they do not, maybe it is unintentional also, right? So what do? They, instead of correcting those words, or instead of correcting any behaviors which is being found in the premises of the health facility itself, what happens? They allow it, right? Like crazy, they laugh together with it, they joke together with the colleagues, with the patients, family together, let's say. It leads to affecting a patient's care. Okay, so these are some these are some types of stigma which we always find in our society. Now, so how does this stigma impacts? Okay, how does it impact? So number 1 is reluctance to seek out treatment, right? Of course, people, because of all this kind of stigma, they will be very reluctant to seek out for treatment. Now, social rejection, avoidance, and isolation. So society, they will reject the individual who is experiencing all these symptoms. They will also reject the society. They will become anti-social, right? Avoidance, it will lead to avoidance. They will no longer feel happy or enthusiastic enough to participate in any kind of activity. Isolation, they will isolate themselves, self-isolation, which we call it often, right? They'll always be in their own room doing nothing, or whatever it is, in their own little world. right? Harassment, violence, and abuse, bullying, which we always find in our campus itself. Let's say in our many of our high schools, many of our colleges, many of our friend circles. Harassment with true words, right? Harassing you by calling you certain words like you are psycho now, you are psycho now. Violence, it will lead to violence also, and it will lead to bullying impacts. And then increased feelings of shame and self-doubt, since the person, since it is perpetrated by myths and misconceptions of mental health illness, it will increase feelings of shame that you are not worth it, that you are not a proper person, and self-doubt, that your confidence levels will go down to an extreme level. All right. Delayed treatment, which increase morbidity and mortality. Here, morbidity and mortality as in what happens. Let's say, just for example, you have started developing symptoms of depression as of now. So depressions are also various types: mild depression, acute depression, and very depression, mild depression, acute depression. We have so many types. Okay. So what happens? Let's say for now you have just started developing depression. Okay, it is not acute yet. For now, let's say you are unable to sleep. Depression because of exam stress, let's say, because of the impending exam stress, let's say. So what happens if you're unable to sleep on time, wake up on time, or just sleeping whole day? What happened? And if you are not dealing with this, and if you are stigmatized into thinking that if I share this, or even if I share that I'm not sleeping these days because of this, people are going to stigmatize me. So you stop, you stop, you even stop, or you are very reluctant to seek out treatment. So it will increase morbidity, as in instead of developing only depression, it will lead to anxiety disorders also. And you never know what it will lead to. It will lead into suicidal ideation itself. Suicidal ideation, as in suicidal thoughts, developing suicidal thoughts, suicidal feelings and beliefs, where you start thinking, I am not worth it. Why am I in this world? Why was I born in this world? Existential crisis will happen. So morbidity, so many other forms of mental illnesses will occur along with it. And mortality, as I said, suicide rate is very high, right? So when, because of delayed treatment, because of not properly intervening with your own friends, family members, or anyone, or with a proper professional, it will lead to very high mortality, where you kill your own self, you kill your own immediate family members together along with it, or anything. Attempted suicide. Again, impacts of mental health. Stigma. So when there is stigma, what happens? When that stigma is not being addressed, it leads to poor understanding between friends and family. Let's say now you are very aware about what mental illness is, so you go back and you start educating yourself. Now you know the differences between mental health and mental illnesses, the difference between the definitions, the types, and everything of disorders. Let's say now you know that just because you have a disorder does not mean you are crazy. Right. Just because you have a physical disorder like a kidney problem, let's say, intestinal problem, let's say, does not make you a cripple, right? Does not make you a disabled person, right? So in the same way, just because once your knowledge about mental disorders are very clear, but if the stigma which is being associated with prejudices, discriminations, which you already found in your own immediate friends and family, it will lead to poor understanding. Even if you try to convey the meaning, the message about what mental health is to your friends and family, they will never be able to understand. Therefore, this impacts the stigma, from social stigma to individual stigma to mental health stigma, everything, it will lead to very poor understanding. Now again, poor quality of life, disability, and increased socioeconomic burden, right? So poor quality of life, of course. Once you start self-isolating yourself, the productivity level of your own self becomes very less. Then disability. Maybe you are not a disabled, maybe you don't have any disability for that matter, but then you disabled yourself when you stop being a productive individual, right? And then increase socioeconomic burden. Here by 2000, 30, it is being the WHO has already labeled India and has already declared India that India will face around 1.3 billion trillion, not even billion, 1.3 trillion losses, economic losses because of mental health issues. And it will lead to worse psychological well-being. As I've already mentioned, when these impacts of mental health stigma are not being addressed properly in your own self and in your own family members, in your own society or environment, it will lead into worse psychological well-being, leading to rejection of your own well-being, rejection, avoidance, isolation, leading to existential crisis, leading to suicides. Okay, now the reason behind why. Okay, now we have already, so now many people, for example, take me as an example, let's say here, when we talk about mental health, let's say, see, I'm very aware already about what mental health is, therefore I'm sharing the message to you. But now I'll have this idea, there are so many people, I've already mentioned in the first initial slide itself, that the people who are willing to talk about mental health is very, very less, right? So why is it very less? We're going to talk about that now. Why is it very less? Why do people find difficult to open up about mental health? Some of the very common reasons which we have found in our research is this. Number one is people, they are very concerned that people will make a big deal of it and spread rumors. That's why they find it very difficult to open up, even if they want to open up and start sharing, right? Number two, it is disrespectful to my religious and cultural beliefs, because our religious and cultural beliefs, let's say, for example, we believe that because you don't pray enough, let's say, because you don't have faith enough in your own self or this thing, you are having this kind of disorders. Let's say our cultural beliefs, like, if you talk about mental health or illness, then that curse will come upon you, and then you will also start experiencing all this, right? Because of all this kind of beliefs makes you to think about not thinking about going for treatment, let's say. So again, number three, not wanting to be treated differently. Nobody wants to be treated differently. We all want to be treated equally, right? Whether we're from different genders, we're from different races or economic background, for example. So they are very afraid, then they're very concerned that they will be treated differently by their own environment, immediate environment, where if they're ever been diagnosed with any kind of disorders. People are also worried that people might think you are weird or leave you out, right? Of course, people will think that you are weird. Why? Because we're still using all those commonly associative words, right? So they will start thinking that you're crazy, you're a psycho, you're dangerous, and then they'll leave you out from that friend circle itself, from that circle, immediate circle. Since we're all social beings, what do? We seek out for social interaction, right? So they are very afraid that they will be leave out, no one to talk to. Just imagine, no one to talk to. As I said, since mental illnesses, they are perpetuated by myths and misconceptions, it is very difficult to let a person understand that what you are going through right now is a very big thing, that it is not just something where you can just snap out of it, right? For example, and also, for example, even if you want to talk to, or even if your friends are willing to listen to you, they are not proper well equipped with how to talk about it. So it is very difficult to even talk about it, right? For example, we have only around, in India, we have only around 300 hospitals which tend to mental illnesses. But those 300 hospitals are also not properly well equipped. For example, take the example of Northeast. Northeast, RIMS Hospital, right? In Manipur, it is one of the leading hospitals which deals with mental illness. Besides that, in a population of millions and millions in Northeast. So, and then again, from that also, they have only around 13 psychiatrists. So just imagine how, when you want to talk, when there is no proper health professionals who are willing to discuss with you, it is very difficult. So that because of all this stigma, which is being perpetrated. Therefore, people choose to take less of a profession. People try not to take a profession which is ladled or with this kind of stigma. Right. So when there's less stigma professionals, then there's less people willing to help you out. Right. Okay. I don't want to admit it. I need support. I am too embarrassed. Self-stigma, perceived stigma, which we have already discussed in the types of stigma. Here, they're very afraid to admit that they need support, that they are not properly functioning as an individual, right? They are too embarrassed themselves because of all those self-perceived stigma. Now, I am being ungrateful for all I have. See, this sentence, even if you don't tell to others, you will start questioning yourself at night, also in the morning, or while you're doing something, while you're planning to give up, let's say. So for example, if you ever complain about anything that because of this exam stress, which I'm using this example because I feel that you will be more relatable with it, right? For example, exam stress because of this pandemic situation, lockdown situation. So you tell to your parents, I feel like I'm not able to sleep. I'm feeling all these excessive mood changes because of all this. Therefore, I feel like I'm not worth it sometimes. For example, even if you share, parents will start scolding you. Because of that, you're depressed. My God, then if you were at my age, when I was your age, I have to undergo all this. I have to undergo this one, that one, that one. They'll start comparing. And then when they start comparing, what do? You start thinking, oh my God, I have never experienced that kind. Therefore, what I'm feeling today is nothing comparable to what my parents have felt. Therefore, I should know the little problem that is been there right now with me. It is not worth mentioning it, right? So that is how we perpetrate stigma and then perpetuate all this discrimination. Now, I have learned, or I will learn to deal with it. This is another very big misconception. As I've already mentioned, how can you learn how to deal with a mental disorder, like, for example, schizophrenia, let's say, or like bipolar or depression, without proper professional help? Right. Just because you Google how to do something, for example, like exercise, eat proper food, let's say sleep on time, let's say. Those are some, or maybe read books, or develop positive thinking, let's say. All those are very good exercise, as we already mentioned. But for example, if you're having any kind of very acute disorders, psychotic disorders, mood disorders, anything, how can you learn? And how will you learn to deal with it without proper help? Right. But many people, especially in our society, they always say, when we say, see, you have experienced one such very big incident, let's say, very traumatic incident, let's say. And when you say, how did you deal with it? Were there any people who were willing to talk with you, who gave you any kind of counseling, who gave you any kind of psychosocial intervention? They will say, no, yeah, I learned how to deal with it. No, they haven't learned how to deal with it yet. That's why their behavior today on how, or let's say avoiding some certain topic, or getting very angry quickly, right, or getting too emotional when such kind of topics are being mentioned, still it is there, it is still there, it is still being perpetuated in their behaviors and feelings, right? So it will lead, as I said, it is already leading, and it will lead to post-traumatic stress disorder, PTSD. Okay. And then lack of education and awareness. People, you yourself, you're unaware about what mental health is, and also because of lack of education, right? Because of that, people, they themselves are finding it very difficult to open up, especially in our books, let's say. We don't have a proper separate subject based on mental health, right? No separate subject. And then there's never a proper awareness, right? It can be a mental health campaign, it can be a mental health checkup, let's say, psychosocial interventions, which colleges does, or our own society does or introduce, right? So because of all this kind of lack of education and awareness, people are finding it very hard to open up. So this is the first step. Therefore, I congratulate and I applaud your college and all the students for having the opportunity to host such kind of awareness campaign, right? Okay, now let's go to the next slide. Now, okay, as we have already mentioned, how what kind of words we use in our conversation. Now, as I've already mentioned, whatever we use and however we think of them is wrong. Now, then the topic is, no, before this, I would like to remind all of you, see, sometimes we will have these kind of difficulties, okay? Me as a professional, sometimes I will experience my own low moments also like this. Clear? Sometimes I will start thinking that I'm too embarrassed to even talk about it because I'm a mental health professional, right? So please be very, very aware and be very sure that it is normal to have these kinds of concerns, okay? And many people feel this way, all right? Feel this way sometimes in their life, okay? But overcoming these kind of worries and then speaking to someone can really have a very big impact, all right? So now let's go to the next slide. Okay, how should we talk about mental health then? Because in the previous slides, I've already mentioned that the way we talk about it, the way we behave, the way we think about it is wrong, right? So then how should we deal with it and how should we talk about mental health then? Okay, so you, all of us, we don't have to have a very special, PhD or even special training to have an open, authentic conversation about mental health. Just remember that just talking about it is the first important step. Talking about it is the most bravest thing that you can do about it. Even if you're not experiencing about mental health, even if you're not having any kind of symptoms, let's say, even if you're just a normal human being for that matter, talking about mental health, talking about mental health with your immediate friends. Now, after going back from this webinar, let's say, talking about it with your friends or talking about it with your immediate family is a very big important step where it will lesser the stigmatized prejudices and discrimination. Okay, I would like to ask the participants, I'm not very sure who the participant is, to mute, okay? Okay, now, how should we talk about mental health then? Number one, proper usage of medical parlance, or else these terms are weaponized and deployed as slurs. See, especially in our society, let's take, for example, media or like opposite political opponents in our country. What do they do? When some political parties are, coming out with some kind of, any kind of policies, let's say, or if they want to, if they're sharing some certain something, the opposition party, they will try to stereotype or try to discriminate someone by saying that, oh my god, that leader is crazy, he's crazy to even mention it, he's a psycho, he's very dangerous. With this kind of ideology, they are very dangerous, right? So just because see, that way, these kind of terms like all those crazy, dangerous, creative, even creative, right? We tend to think that people with mental illnesses, they are very creative. Therefore, in movies, you will see them with, they'll be like some kind of geniuses, right? All those are generalization I've already mentioned. Okay, so you should have a proper usage of medical parlance. Even stupid, moron, idiot, as I've already mentioned, those are terms, connotations with proper IQ, proper definitions, right? And which you are not supposed to just use it, throw up there all over the places. Clear? It can be weaponized. Weaponized as in it can be used to discriminate someone. It can be used to dehumanize someone. Okay. Okay. Now, ask instead of assume. Instead of assuming that just because a person is being, very inactive these days, you start thinking that he's having depression or she's having depression, right? So instead of assuming such thing, ask them directly. Who knows, he or she, instead of being depressed, they might be preparing for some kind of exam, or they might be having some kind of their own proper self meditations also. You never know. So ask instead of assuming and then spreading false rumors. Now, the best way to understand someone's mental health problem is talk to them. Talking inspires others to do the same. When you start talking, then you have leveled the ground a bit. Now, when you start talking, people will come forward and they will also start talking. They will also start sharing. They will be inspired by how you can do it. Clear? So this is how you talk about mental health. Ask twice and let them know you are there to listen. It is very important to ask twice. For example, let's take the example of using WhatsApp. Because you're unable to meet your friends these days, what do? How do? You just ask, hey, how are you? A long time no see, let's say. Nobody will start their conversation by saying, thank you for asking. These days I'm not feeling well. I'm very unwell. These days I'm unhappy. I'm experiencing all this. They will never say, nobody will say. They will just say, I'm fine, thank you. They always say that, even if they are undergoing a crisis, right? Or let's say, if they're undergoing a familial crisis where a person, one of their family members have died, passed away, and then afterward you ask them, you try to reach them by asking, hey, how are you? I'm so sorry for your loss. They will never answer, I'm well now, I'm better. No, they will never answer that, these days I cannot sleep, I cannot this one. They will start by saying, yes, thank you, I'm feeling better now, right? So always remember to ask twice. Okay, for example, how are you? Then if they say, I'm fine, thank you, then you can always say, are you sure? Then they will start. If you ask them, are you sure? Then they'll say, actually, I'm not so fine, right? How can I help? These are some kind of very, very simple sentences which you can use in your immediate conversations. Now, don't dismiss mental health within your own culture. It's very important. As I've already mentioned, all these stereotypes, prejudices, and discriminations happened in our own immediate culture. Okay, in some culture, let's say Japanese or USA, they're talking about mental health. Mental health has become normalized. Is a normalized thing now. They can just up and about briefly talk about mental health, right? Without anyone, without the fear of being prejudiced, right? But in our culture right now, it is still being very stigmatized. It is such a very stigmatized word, right? Because of all those myths, right? So make sure that just because you have learned about mental health today, don't dismiss it by saying that, okay, now that I know about mental health, I will act accordingly. I will make sure that I check myself whenever I'm talking about it. But what can I do? It is in my society, therefore it's all right. Society, though I cannot handle it, so let it be like that. But in my own immediate circle, I'll try to do it. No, please make sure to dismiss it. I mean, not to dismiss it. I mean, okay, not to dismiss that mental health topic in your own culture. Be sure to, whenever there's any opportunity about such kind of topics, please initiate it. Talk about it. When ask the WH questions, why, when, what happened, everything clear. Where, why do we think like that? How do we think like that? How do we behave then? For example, let's say, I think I think most of you will again relate with me when I say that, let's say, grieving process, right? There are so many stages of grieving, okay? How a person overcomes their grief, right? So especially, let's say there's a sudden family death in your family. So what happened? You are allowed to cry. Okay, you are allowed to vent out your frustrations, everything, emotions. But once the someone is being buried, once that person is being buried, what happened? We're always shushed, we're always admonished, or we're always advised by our own family friends or family members by saying that now you should not cry anymore. If you cry, then it is a disgrace to the person who has passed away. I don't know whether you find it relatable or not, because in my society we tend to do that. We try to discourage a person from crying. Okay, especially after the burial or funeral services, right? Because we think that if we cry like that, then we're not doing justice to the person who has passed away, right? So what happens then when you don't vent out whatever is being feeling, whatever you are feeling about it? Then you will internalize everything, and then it will lead into disorders. Clear? So some people, they will find it, they will be in a shock because of all those kind of news. Therefore, they will not be able to react accordingly to the societal norms, like crying or pulling out your hair and crying, right? Some people will be angry first. They will start blaming, they will fight with others, they will start drinking just to deal with the pain, right? Some people, they will cry, and then they will move on. Some people, they will not cry, they will stop talking, they will stop eating and everything, and then afterward only they will doing some kind of immediate situation, like trigger. I've already mentioned, after months and months also, let's say, when they see a little picture photograph of the person who has passed away, it will trigger all the emotions, and there and then itself they will start crying. So it happens. Grieving process is a very complicated thing. Okay, so in a society, when it comes to mental health and mental issues and everything like this, like grieving, for example, we try to we try to dismiss. Okay, so make sure that whenever there's any opportunity to talk about mental health in your culture, please make sure to not dismiss about it, to go forward and initiate the conversation. Now, here, it is not just time to talk about mental health, it is time to ask twice, as I already mentioned. Listen to them, listen to whoever is sharing with you about your problems, and at least care. We're not asking that you start providing interventions, you start providing counseling. The only thing that a person wants from any other person is that they, even if they can't understand, at least they care enough to ask about your well-being. Right. So it is not just time to talk about mental health. Why? Because our country is already, while experiencing pandemic, we're also experiencing mental health epidemic. And our country is being labeled the world's most depressed country in the world, right? Because of our culture, right? So please make sure not to only ask, but also to listen and start caring. Now, okay, then, if I already mentioned how you should talk about it, now, how do you properly initiate a conversation? Okay, as students, as individuals, responsible individuals, if you're experiencing your own self about any kind of situations like this, symptoms like this, ask yourself or ask your friends who are already experiencing, whom you believe that they're experiencing. Okay, number one, let people know you're willing to talk about mental health. If you're not willing to talk about mental health, nobody is going to open up to you, right? If you're not going to ask twice or tell that you are willing to listen to them, they're not going to ask, they're not going to talk about it, right? So allow the person, allow this kind of topic, okay, to come out naturally in your conversation, right? For example, you can always use this kind of example. See, if you think that your friend is undergoing depression these days, self-isolating, not eating, sudden weight loss, sudden weight gain, or anything, then you can start by initiating the conversation with your own what do you call, with your own conversation, by sharing your own thing. Like, for example, I've had times in my life when I've been, struggling like this. Me too, I've experienced like this. So I went to talk to someone, and it has helped me a lot. Therefore, I feel that if you whatever you're experiencing, if you talk to me, it will also help you also by venting out, right? Number two, normalize mental health by talking about it directly. If you talk about mental health, like if you talk about fashion, then it is a normal thing anymore. Now then, people will not be stigmatized. People will not have any kind of prejudices, right, related to mental health. So normalize it, right? Normalize mental health, then ask about changes and coping skills. Very important. Here, your friend, since we're taking the example of a friend who is undergoing depression because of exam stress, let's say, right? So you can start the conversation, initiate the conversation with a proper expression of care and observation, right? For example, I wonder if what is happening to you these days, that you're unable to sleep, you're unable to eat on time. What is happening to you these days is the reason that is stressing you out, the exam anxiety, everything. So I wonder if this is the thing that is stressing you out. If it's stressing you out, how are you dealing with it? How are you coping with it? Are you at least trying to sleep or not? Nah? Are you at least trying to eat or not? Even if you are not willing to eat this kind of vegetables, let's say, or this kind of meal, how about you switch up your diet to something, and are you trying to cope with it or not, right? You can initiate the conversation like that. Then please make sure that the timing doesn't have to be perfect. Okay, you don't have to wait for the perfect timing to talk to someone, to talk to your friend. Okay, so for example, if today you saw your friend experiencing all those kind of symptoms, right, for example, so, and if today you don't have the time because you're in a hurry, let's say, and while texting you find that your friend is like, I'm very unhappy these days, I'm unable to do this one, and you're in a hurry now, right now you cannot reply that properly to your friend, let's say. So tomorrow also, right, tomorrow also you can always remind the person that you care and is willing to talk about it. So you can always circle back to that day when you have left, right? Circle back and ask them, yesterday, the day before, you can just start by asking something like that, that the day before I felt that, you were very unhappy, or that I felt that I can sense a bit of, anxiety or anxiousness from you while we were talking about exam, let's say. So can we grab some coffee, can we grab some coffee and then, talk about it? Or, can we have a virtual discussion through WhatsApp, anything, right? Then reassure them when they hesitate. As I said, no people will, first, they will not, just up and about start explaining everything to you. They will not just open up everything to you directly. So when they hesitate, whether they're very unsure whether to share it with you or not, please make sure that you always tell them that I am here to listen and support you. Okay, you don't have to support your friend with financial matters, right? Or because of lockdown also, you will be unable to physically support your friends, right? So how do you support, how do you provide support? By always keeping in touch with them, by telling them that yes, just because you're feeling unhappy today doesn't mean that you're an unhappy person. I know that you're always happy, that you have been a very good, strong individual, and therefore you can do it. These days, because of exam stress, I am also facing the same thing, similar thing, let's say. And therefore, if we think about it like this, in this way, and if we talk about it, I think we can support each other and we can do like this. You can always talk like that. And if you think that exam stress is the thing that is making you feel all these things, then maybe how about we talk to a teacher, ask them about this, always reach out to our teacher. That way you give support. All right. Okay. Offer help to connect with someone they are comfortable with. It's very important. Okay. So for example, if you think that you are not capable of handling whatever your friend is telling you about their situation, then, or if you feel that that friend, see, your that friend does not have to be your best friend, right? You have your own best friends, you have your own best buddies, and you also have your own, high buy friends, let's say. For example, in that circle of contacts, you find that one of your high buy friends, they experience something. So even if you're willing to give support to them, those friends, they might not be, willing to open up to you, right? So you can always ask them, is there someone else whom you feel comfortable enough with, who you can, who will be able to support you better? Then if they say yes, actually my best friend, or actually I really like talking with the teacher, then you can say, then I'll try to reach out to the teacher, and then let us reach out to the teacher, and then let the teacher help you, or let your friends help you, right? Offer help to connect with someone, right? Or if they say that actually I'm very close with my parents, right, then try to reach out to their parents, right? That hello auntie and uncle, how are you all? Because of this exam stress, we're unable to sleep, therefore I'm also feeling the same thing. I think your son or daughter is also experiencing the same thing, so please don't stress them too much by scolding them often or something. You can always reach out. Okay. And then be direct if you suspect they're thinking about suicide. It's very important. As I said, after COVID lockdown, 20% has increased, right? Mental illness. So with 20%, there are lots of suicide rates. Okay, so you and me, anyone, we are susceptible to such kind of suicidal ideations. Clear? So for example, I might also, some days I will have too much of these kind of pressures can lead me into having a very low times. Okay, so for example, then I start thinking about what exactly am I helping, how exactly I am contributing. I'm not contributing enough, therefore I think my existence in this world is not enough. Maybe I'll try to, even if I die, no one will mourn for me. You might start thinking like that, or your friends might start sharing with you like that, that maybe I am not worth it. Actually, maybe what my friend said is true, right? Maybe I'm not that of a person, let's say. So if you, when they start saying such kind of life crisis, right, which we like to call it, or existential crisis, for example, or if they start telling like that, please be very direct. Okay, so you can directly ask them, does it ever get so tough that you start thinking of ending your life? You can always ask them. And please here, make sure to never use such kind of words like, you're not thinking of killing yourself, right? Please don't say like that, okay? When you use that kind of words, what happened? That sentence itself is full of prejudice. So you're not thinking of killing yourself, right? When you say like that, the person who is experiencing and thinking of killing themselves, they will deny it. They will say, no, man, never. What do you think of me? No, they will say like that, right? They will start denying. And then afterward, they will internalize this notion that even my friends see it, they'll find me very stupid if I say that I'm having a crisis. Therefore, I will not share with them. All these stigma will come again, right? So be very direct. Ask them, since you're unable to sleep, you're having all these kind of thoughts. Has it ever crossed your mind that any in any day or any situation where you are planning to even end your life sometime? You can always ask that, okay? Then again, if so, stay calm and ask some follow-up questions. Right. If so, as in if your if your friend is thinking of, sharing with you that, yeah, man, sometimes while I'm sleeping, midnight also, sometimes I used to think about my life. I used to think about, what I'm contributing, and therefore I used to think that even if I die, I will be a little bit more happier, right? Then when they start telling like that, right? Or there will be so many situations, okay? Maybe some will be very direct and upfront with you by saying, yeah, man, I used to Google even in YouTube also, or Google it and search it, and see how the best way to die. Some people will say like that, okay? So then please stay calm, okay? You have to be very calm, okay? Don't panic together with them just because they share those, okay? And you have to ask some follow-up questions, okay? So some follow-up questions can be like, how often do you think about this kind of thoughts? How often do you think about killing yourself or ending your life or ending someone's life, for example? Then what scares you the most when you have these kind of thoughts? These are some kind of follow-up questions which you should always use, right? So, what scares you? Don't you feel scared or thinking about this? Don't you feel a little bit? Do you feel relief when you think like that? Or when you think like that, what comes into your mind? All those things. Those are called follow-up questions, okay? Don't just say, just because they shared that. Yes, man, I'm thinking of killing myself, let's say. I mean, think of ending my life. Then you say, oh yeah, don't do like that. It's not good. Don't say like that. Don't start teaching. Okay? Okay, so now it's very important how to continue the conversation. How to continue the conversation is how to continue the conversation with your friend who is thinking about ending their life. Here, you might tell that our webinar's topic is on stigma, right? So it is not about suicide, right? But as I've said, when you start talking about stigma about mental health, then it will ultimately lead to suicide. It will ultimately lead to self harming. Okay, so as I said, it is already been mentioned that India is undergoing mental health epidemic, and there are so many suicide case rate. Okay, we have the highest suicide rate cases from the age of 15 to 29 years. Okay, so therefore, in your conversation about mental health, you will always come across this kind of situation where one of your friends or even your own self, okay, even yourself will develop this kind of thoughts. Therefore, I am prepping you if such kind of situation arises, if such kind of conversation arises, right? So if your friend says that they are thinking of such kind of thoughts, what do you do? What is your first thought? Reassure them that help is available and that these feelings are a signal that it is time to talk to a mental health professional. Very important, okay? Please tell them that, see, or even if you want to help, even if you want to end yourself, there's no one who is going to help. Therefore, I think the best way is to end yourself. Don't say like that. Tell them that there's help available, okay? The help available can be not even professionals. It can be your immediate friends. You yourself is an help, okay? Your that friend's parents, friend circle, that is help itself, okay? So, and tell them that when they start feeling like this, when they start thinking of such kind, then high time that they start talking to a mental health professional. Clear? And follow their lead and know when to take a break. Follow your friend's lead. Okay? Don't cross questions them. Okay? This is a very tough conversation, okay? Talking about mental health is a very tough conversation. But talking about suicide itself is more tough. Who is going to admit openly that, you know what, I don't feel good about myself, therefore I'm going to kill myself? No, it's going to be a very tough conversation, right? So they will start opening slowly to you, right? So you can always ask them, is it too much for you? Are you sharing too much? Are you feeling very hard when you start sharing all these things? Are you okay with continuing our conversation? Do you want to talk about this later afterward? You can always ask like that. Clear? Broach the subject about getting professional help. It's very important. See, even if you try to be a very supportive friend, you are still not a professional, right? Therefore, certain topics like this, you will not be able to help your friend. Therefore, always broach the subject, okay? Tell that I really think that talking about this to someone else can help you gain another new perspective, nah? And keep things from getting worse, right? So this is how you tell your friends. Tell them that if you talk, if you, I think that if you talk to someone who is a professional, they will give you a better perspective, na? Some perspective better than your own perspective, better than your, or maybe different from your narrative about your life, na? And they will help you from making some kind of drastic situations, right? And then offer to help them connect. It is very important again. Okay. After saying that, please don't leave them hanging. Right. Offer to help them connect. As in, sometimes see, what do we call? Sometimes first professional contact can be very hard, especially if you yourself are experiencing some kind of trouble and you have come to me for counseling, let's say. So you don't just open up directly, okay? You will, counselor also, as well as the clients especially, they find it very difficult to someone, even a professional counselor, okay, to tell out that they have a problem, right? They're too embarrassed to share that. What if I say that I'm having all these stresses, and then the counselor think that this is not actually a big deal, right? So it is a, that's why sometimes the first conversation with with a professional can be the hardest, okay? Therefore, how can you support your friend? You can support your friend by saying, I could walk with you, or I could drive you to your appointment, no? I could walk with you to your appointment, and then afterward we could have a coffee to coffee together afterwards. You can always say that. Help them connect, right? At least in your appointment, I will not be able to help you, right? You have to talk with the counselor yourself, but at least I can work together with you. I will wait for you, and then afterward also we can talk about it. No, that is how you help your support. Okay. Number 5, reassure them about your concern for privacy. This is very, very important. One thing about this is, see, many of us, we are very, very, what do we say? We are not happy. We are very scared that what if I say that I have an issue, and then, they start still, prejudicing me. They start knowing all about my information, everything. No, very scary. So please reassure them that mental health, when it comes to mental health, it has greater confidentiality than any confidentiality safeguards than any physical health treatment. Okay, so it's confidentiality is a very big thing in mental health. All right. So even if you come to me with all your problems, I am never going to share your problems to anyone, to even my own family members, relatives, like boyfriends, husband, or even my own colleagues. Okay, so that confidentiality is very important. So whenever you're telling to your friends, you can always tell, if they say that, my God, then people will learn about me if I start sharing, then tell them that actually mental health confidentiality safeguard is much, much higher than any other physical health, okay, in hospitals, for example. Okay. Now, be patient and don't push too hard if they refuse. Please be patient, okay? Some people will only tell you that I'm feeling a little bit unhealthy these days. They will only say that. Then even if you want to know more about it, they will not open up to you. They will say, someday I will try to share someday, right? So don't push too hard. You can say that, okay, if you're not ready right now, then you can tell me whenever you are ready, okay? I'll always be there. Tell them. Don't push them by saying, my God, you should address this situation right now. Don't say like that, okay? And if, okay, and you can always say, what do we call? Uh, if they're willing to talk about it, then you will help them connect everything. You can start by saying that, okay? And if they are in immediate danger, that is, what is immediate danger here? Immediate danger is self-harming or about to harm themselves. or others, right? Please stay with them. Here, stay with them as in you don't have to be physically present with them. Stay with them connected in the phone. Talk about something. Try to divert the attention to something else, right? Stay with them. Message with them, talk about anything, right? Help them remove lethal means, right? For example, if they say that, I'm trying to end my life by consuming these pills or by hanging myself with this rope. Then you say, you know what, we talk about this one, you divert the topic, and then afterward tell them that, this rope is actually not good. How about first you remove this rod to this place? How about you remove the knife, this one, and then we'll do like this. Now, try to divert, try to help them, okay? And call local and national helpline. It's very, very important. Here, if you just Google search it, there will be so many helpline numbers, all right? So with that helpline numbers, immediately they will be able to take over the situation, okay? You can just call them and say that I have a friend who is trying to kill themselves or harm themselves, or who is thinking of harming themselves, right? I don't know when they're going to harm themselves, but I feel that they're going to harm themselves. If you think like that, call the helpline, and then the helpline will take over. The helpline will make sure that the person does not think like that, does not act through with whatever they're thinking. Okay, so there are so many helplines out there, even your own local Nagaland State Helpline, Child Line. There are so many helpline. Okay, then encourage them to seek help or contact their doctor or therapist. Here, encourage them to seek help with their own family members. If they say that their family members are the ones who is, treating them very bad, encourage them to seek help in the form of teachers, right? In the form of seniors who can help them, right? Or if they're already diagnosed with a mental disorder and they have a proper doctor of their own doctor, encourage them to call their doctor and talk to their doctor. Clear? That is how you continue a conversation, how you initiate a conversation with your friends, right? About mental health. Okay. Now, before we end this, I would like to, share a rubric to help our mental language. Okay. See, instead of saying, instead of using, he is disabled or he is handicapped in your conversation, right? Please try to use he is a person with disability. Clear? He is not disabled. He is a person with disability. Clear? Okay, now, instead of saying that she is brain damaged, now she is brain damaged, what do you say? She has a brain injury. Clear? Instead of saying addict, he is an addict, she is an addict, she is an abuser, he is a junkie. Instead of saying like that, please tell that he or she is a person experiencing alcohol or drug problem. They are experiencing, okay? Those experiences can be removed with proper therapy, with proper medication. Therefore, their whole life, they are not going to be abusers themselves. They are not going to be junkie themselves, right? So make sure to always use this kind of preferred language. Instead of saying she is mentally retarded, here the word retarded is a very politically incorrect term, right? So if you go back and check the meaning about it, it doesn't even have a logic. Retarded, okay? Your brain doesn't go retarded, okay? Just because you have a mental illness, right? Your brain, just because you're experiencing depression doesn't mean that your brain reduces in size. Clear? So instead of saying she or he is a mentally retarded or mentally ill, always use she has a intellectual disability or mental diagnosis. Clear? Instead of saying mental health patient or a case, call them she's receiving mental health services. Very important. Instead of using it drives me crazy. See, when you say it drives me crazy, when you put crazy in your sentence, what does the meaning, what is the attaching meaning to that? Crazy as in, very dangerous, very psychotic, right? Just because of some little situation, right? So when you use that word, then people who are thinking, when they get the word crazy, they'll think that it is driving you, whatever it is, crazy, all those myths, stereotypical myths, right? So always use it annoys me, okay? So individual with high needs, there are no individual with high needs, okay? If you're able to properly diagnose someone and then you follow through with that medications, those people themselves, they can take care of themselves, right? With proper caretaking services, right? So they don't have to have a very high needs, right? Very special needs, okay? So always use individual with service needs, Okay, and instead of using those who have mental illness, always use people who have mental illness. Very important. All of us are people, okay? Whether you are having mental illness or whether I'm having mental illness, at the end of the day, we're all human beings, okay? So today, as we said, in our life, in our lifetime, okay, all of us were going to experience at least one diagnosable mental illness in our life, okay? Therefore, please never use those who have mental illness, okay? Don't try to divide the people, those people and we people, okay? Always use people who have mental illness, people who have service needs, okay? People who are receiving mental health service, clear? And instead of using she's OCD, right? Please mention she has obsessive compulsive disorder. It's like, see, when you say she's OCD, it's just like you have a broken arm, right? So what do? Physical illness is a broken arm, let's say. Then you don't call a person by saying she's broken arm. Nah, you don't call them she's broken arm, or you don't call them just because, let's take cancer. She's cancer. You don't say she's cancer, right? You say she has cancer. You say she has a broken arm, right? So please make sure that same thing with mental illnesses. Don't ever use she's OCD. She has obsessive compulsive disorder. Clear? And never to use suffering from mental illness. Please always use living with mental illness. Clear? Just because you have autism, just because you have ADHD doesn't mean you are suffering, okay? You are just living with that illness. Clear? As I said, people who have these kind of mental illnesses sometimes are way much productive than us. They're way much more influential than us again. So please make sure. And then instead of using your word like that's crazy, insane, psycho, always use that's wild, that's bizarre, that's odd. Clear? Okay, now. So, okay, before our last slide, let us see. Since we have come to the conclusion of our point, I would like to mention how you and me, we can help contribute, okay, to solving this kind of mental health issues in our country. Okay, some immediate steps are you can provide, okay, wait, see, you might think that this kind of changing your topic, changing your mental language is not that important, right? But our language choices, the way we use this kind of language, it have a very powerful impact on how you yourself view mental illness, right? And how you yourself view people with mental health issues, right? These words, if you're using this kind of she's mentally retarded, for example, this kind of words, they marginalize, they also alienate and stigmatize people, right? And so by correcting our mental language properly, right, from instead of using this kind to a proper preferred language, our society can grow in understanding of how we can treat each other better. Clear? Not as different people, not as those who they are, this one, instead of that, as a we. Okay, so it's very important that you take care, you filter your language properly, mental health language properly. Clear? Now let's go to the last slide. Provide psychoeducation. It's very important. Right now I'm providing psychoeducation to all of you, right, by educating you about some psychological terms, about mental health illnesses and everything. Therefore, you, in your same way, same part, please make sure that you also psychoeducate your friends, families, all right, your immediate environment. Now, proximity or direct contact with people with mental illness. Here research has already shown that this is the best way to deal with your stigmatized version. Okay, so if you have direct contact with people who are living with mental illnesses like autism, let's say, depression, then you start understanding them, then you empathize with them, and then you will see that instead of all those differences that you talk about and you see in them from afar, you will see similarities, and then it will help reduce your stigmatizing stereotypes levels that you're using right now. Okay, now talk, listen, and learn. Open discussion and dialogue with the general public and not just the experts. Okay, here please make sure that don't wait for the experts to come and talk to you, okay, or teach you. Okay, as I said, first thing to any kind of conversation is talking about it. That is the most bravest thing you can do about it, right? So you can just open the discussion among your own friend. You can talk about exam stress today, and then talk about how it is impacting you in your health, right? How exam stress is affecting you, right? Okay, I'm so sorry. Okay, and then reject stigma response, and then investment push from this one. Please make sure, since I already mentioned outrageous lack in funding and fundraising, right? So please make sure that you also help the government, ask the government to push for proper advocacy, right? And then provide support for organizations that fight mental health stigma. You can join them, you can volunteer, you can also donate money to all these kind of organizations, right? So the influence and effectiveness of organizations fighting for this kind of stigma depend on the large extent of volunteers on donations. Okay, you can make a contribution by getting involved with donating money, with volunteering your services, or with joining. Okay, so see, last slide. Can you recognize these people? Abraham Lincoln, Princess Diana, David Beckham, see Buzz Aldrin. What are they? What do they have in common? That they all have mental illnesses. Okay, therefore please make sure that people from all walks of life and throughout history have been very successful and productive while living with mental illness. Okay, therefore please make sure that conversation saves lives. Okay, make today the day you start one. Yeah, these are some of the books which you can read about it if you're interested. The Mark of Shame, okay? The Perks of Being a Wallflower by Stephen Chbosky. The Curious Incident of the Dog in the Nighttime, very, very good book. Veronica Dice by Paulo Coelho. Girl Interrupted. All these are very good books which you can always read up, okay? Thank you. And if you have any more queries on this topic, you can always email me through this number or this account, and I will always be ready to help. Okay, I'm always there if you are having any kind of queries more on this topic, or if you want to know detailedly about any kind of topics that we have already addressed, then you can always reach me through this. All right. Okay, thank you for participating. And that's the end of my presentation. I hope that now at least you know a little bit about what mental health is, and that something you take something out of that, what you find is useful, and use it. Okay, thank you.
Thank you so much, Ms. A. Charani, for your wonderful presentation. Before we start this session, I had a list of questions to be asked after your presentation, but you tried to answer all of it even before I raised the question. So thank you so much. I have few. Meanwhile, I can ask the participants to please post your questions if you have any in the comment section. You mentioned that different people experience different kinds of symptoms when we are living with mental illness. But can you please tell us in brief, like what are the common signs where we can identify that the person is, living with mental illness, or we ourselves can identify that we are living with one?
Yes. So some common signs which you can find in yourself. Or before answering that, I would like to tell that because again, I have no light. So my battery is very low again. So if by any chance, if I leave, please excuse me, and you can always reach out to me. That's what, and I'll try to answer as much as I can. So some of the common symptoms that you can find is from your own mood behavior. Okay, maybe you are a very jolly person, but these days you can find that your mood is increasing or decreasing or varying too much. No, so through that also you can know. Or let's say sleep, as I said, sleep routine. Let's say if you're not sleeping on time, if you cannot fall asleep at all, or if you're always sleeping, let's say insomnia disorder, that is another very common what do we call symptoms. And then food, weight loss, sudden weight gain, very, very important. And when you start isolating yourself too much, when you no longer follow whatever habits you used to have, when you stop following all those habits, then you start asking yourself, am I experiencing mild depression? Am I becoming depressed? Now you can start asking all those. Those are the very common symptoms that leads to mental illness. Okay, just because you're having all these kind of symptoms doesn't mean that you're already depressed. Okay, it's just that you're developing slowly. Like it's like just like, let's say for example cancer, right? Before you have a full-blown stage, for example, you start developing symptoms slowly, right? And then if you can address those symptoms, then your treatment can be done on time, right? And then you will never have all those kind of disorders, right? So please keep all those in mind. Okay, symptoms.
Okay, thank you so much. And one more thing I need to know, since we don't discuss this mental illness in, like, it has been stigmatized, and
Yes.
so no, I mean, not many people have idea about its treatment and the procedure and its
Yes.
cost. If it's not very personal, how much it costs? Is it very expensive, or can anybody, I mean, afford the treatment? What is the procedure
Yes.
like?
Okay. As I've mentioned, because of the very low funding by the government, the expenses about all these treatments are a little bit expensive. But there are so many organizations which are working to make sure that people are having proper connectivity, proper channels to seek professional help without all this kind of expensive treatment. Let's say while I was working in NIPSIT, that is a government institution for mental health, what happened was there were so many clients. Most 70% of the clients were from Manipur and Nagaland itself, right? Because these two states in Northeast, they are one of the most black sheep states, right?
Oh, yeah. Okay, Miss Charani, I cannot hear you. Miss Charani, I think the power went off. Her battery might have died. Is it just me, or the rest of the participants cannot communicate with her? Somebody may leave a comment mentioning whether you can. Okay. I think meanwhile, before we